Welcome to Dementia Resilience with Jill Lorenz, a candid conversation as we learn about dementia, Alzheimer's, and its effects on the people we love. Jill's years of dedication and experience help you adapt, recover, overcome obstacles, and help find a positive outcome. It's time for Dementia Resilience with Jill Lorenz.
Good morning. Welcome, listeners. I hope everybody in Caregiver Nation is having a wonderful day today. It is a great weekend to celebrate those who have served our country, and we don't want to forget them ever, ever, ever. We thank you all for your service and for those who have left us behind and given the ultimate sacrifice for our country. I'm excited today on Dementia Resilience with Jill Lorenz to have some guests with me from the Colorado Department of Public Health and Environment. Welcome, Randy Kuykendall.
Kuykendall.
Yes, Jill. I almost got your name right.
Almost did.
And Elaine McManis.
Yep.
Welcome.
Thank you.
I have you both here today because I want to talk about these new assisted living regulations, but let's start with introducing you to my listeners. So, Elaine, let's start with you. Tell us who you are and what you do at the CDPHE. Got it.
Right. So, I'm a branch chief for health, home, and community services facilities. And in that branch, we oversee the regulation for assisted living, home health, and hospice, and a few of the community-based Medicaid waiver programs.
Okay, great. Well, I'm glad you're here.
Thank you.
Randy?
Good morning, Jill. I'm Randy Kuykendall. I'm Director of the Health Facilities and Emergency Medical Services Division at the Colorado Department of Public Health and Environment. And so I'm responsible for Elaine's branch as well as 7 other branches. We're essentially responsible for overseeing, regulating, and supporting Colorado's healthcare system.
Okay. Well, great. You know, recently we had some new regulations that were brought forth, and the Board of Health was presented with some ideas that it took about 5,000 hours for you all to put together. But the plan was to have some better regulations for people working in communities, assisted living, memory units, group homes, whatever it may be, to have some training and some new regulations around how they care for people. And our friends with diagnosis especially matters to me. So I want to talk about that today because there's a lot of misconceptions. But for me, these regulations passing were a great win for my families and my caregiver nation out there who are my listeners. But let's talk about these regulations. Randy, do you want to start?
Oh, absolutely, Jill. Thank you. Well, I think it's important to put into perspective sort of where this industry has come from and where we are today. The regulations had never actually been overhauled for assisted living residences in Colorado since their initial promulgation in about 1986.
Wow.
And I think everyone would probably agree that our healthcare system has changed an awful lot in the past 25 years.
Right.
As a part of Governor Hickenlooper's requirement that we continually look at our regulations and minimum standards, particularly in healthcare, and make sure that they are current and that they are keeping up with the standard of care. About 2.5 years ago, we took on this particular regulation set. Elaine and her team, which was, you're right, there were over 5,000 hours of volunteer time put into this project. There were well over that many and then some staff hours put into the project to essentially completely update the minimum safety standards for assisted livings. I think the audience would probably be surprised to know that, assisted living accounts for a little over 23,000 beds in our state of all types, memory care as well as non-memory care. The group that was put together was the Assisted Living Advisory Council, and open meetings were held for over 2 years. We did community-wide meetings. We did on around the state sort of town hall process as well. And I think most importantly, 80% of what's in these new regulations is a repeat of what's been in place in terms of healthcare safety for residents in these facilities.
Okay.
Yes, the other 20% is a little bit newer, and Elaine is certainly our subject matter expert in that area and the manner in which we're going to go about implementing these. But it's important to stress that from the department's perspective, we have 2 goals. Number one, to protect the health, safety, and welfare of every Coloradan accessing our healthcare system in Colorado.
Excellent.
But equally as important to ensure access to care, which means our regulations need to be fair and allow the providers the latitude that they need to provide care and be profitable. So those two things have to work together, and I think we've achieved that with these regulations.
Oh, that's wonderful. I'm glad you pointed out that we have to look at both sides. Where I have concerns is many of my folks, my Parkinson's people, my people with mild cognitive impairment that have Alzheimer's, hippocampal sclerosis, Lewy body, what have you, end up in some of these assisted livings. Mm-hmm. So, Elaine, what was going on in your mind? What kind of feedback were you getting from communities that made you want to spearhead this initiative in the first place? And what are you really trying to accomplish?
I think most importantly, there's no standard of practice for personal care workers. And so I think the training and the oversight was varied among the assisted living facilities. So we were hoping that beefing up, if you will, the training requirements, the oversight by the staff at the assisted living, that it would create a standard across assisted living facilities in our state. So we focused a lot on education and training and oversight, right, which I don't think was covered real well in the previous rules.
True. Is it true, Elaine, that we did not in past years require anyone to have any continuing education credits if they just came in and to work in a community assisted living or something like that? They could take 8 hours of training and never have training again?
That's correct.
Okay. And there's high turnover in these places.
That's right.
Changing needs, better diagnosis. So the communication skills are getting better, but it wasn't transcending down to the communities, in my mind. Right.
And the population, the landscape has changed for the folks that are served in assisted living right now.
Right.
And the staff training to accommodate for the type of people that they were serving just really didn't exist at least a minimum standard in the rules. Mm-hmm. I think what used to be a sort of a board and care type model of assisted living when these rules were first initiated has changed so much in the now in the future that the assisted living facilities are being asked to take more complex care needs,
right?
And that training and the support for the staff hasn't been there, and I think it's been frustrating for staff. Mm-hmm. I think that staff do their best and make attempts to provide the care, but the base that helps them to know what to do just isn't in the current or previous rules.
Absolutely. And when we get into the second part of our conversation, I just want to really dive into deep of who does this affect, who isn't included in this. But I just want to say, when I was at the state meeting when we were trying to pass these regulations in the first place, I was really struck by the fairness. And I really want to say, Randy, I thought you and your team did a great job listening to the owners of these assisted livings who were worried about whether they could afford the costs and so on and so forth. And as you roll this plan out, you're really going to work with them and say, tell us what struggles you're having. We're going to try to help you somehow, but you've got to be vocal and let us know. And this will be sort of a fluid process. And so when we come back from our break, I want to talk about who does this actually affect and what are some of the new regulations coming in that people are so worried about, because I think we can dispel some real rumors and untruths that maybe didn't mean to be that way, but it came out. So we'll take a break, listen to a word from our sponsor, and we will be right back with the folks from the Colorado Department of Health and Environment. Hey friends, I'm excited to tell you about Pine Grove Crossing Assisted Living and Memory Care in Parker, Colorado. They set the bar high for person-centered care. They're locally owned, and they focus on exceeding their residents' expectations while providing excellent dining, housekeeping, and transportation services. Their care team with licensed nurses are available 16 hours per day, 7 days a week, to ensure clinical needs are addressed as soon as possible. Check them out at pinegrovecrossing.com or 303-996-8000 and see how care goes into everything they do.
It's time for Dementia Resilience with Jill Lorenz.
Okay, I'm back with Elaine McManis and Randy Kuykendall. I got it right.
You did. Thank you. Thank you very much.
With the Colorado Department of Public Health and Environment. And we have been talking about the new assisted living regulations that are going to be rolled out in the next 12 to 18 months. So, Randy, who is this actually affecting? Are my memory care folks going to be cared for? Are we touching that?
Yes, we are, Jill. If it is in an assisted living environment, these regulations are the minimum safety standards and care standards to receive a license to be able to operate as an assisted living residence.
Okay.
I know there's a lot of confusion out there. We answer an awful lot of questions on our helpline in terms of assisted livings versus independent living, what kind of services are there. It's important to note that independent living facilities are not regulated at the state level. They're not required to have a state license because that is a more well population, if you will, that are being served generally in those types of environments. Assisted livings are required to be licensed by the Department of Public Health and Environment. And so this would affect assisted livings regardless of the type of population they may be serving. These regulations actually separated out for the very first time specific requirements for memory care in particular. To meet the specific needs of that population, which unfortunately, as we all know, continues to be rampant throughout our population. And the department wants to do everything that it possibly can to ensure that these residents receive the kind of safe care that they absolutely deserve.
Right. And Elaine, I worry that I get calls from families saying, what do you know about these group homes? They're popping up all over the place, 6 to 10 beds, 12 beds, 16 beds, with no regulations, no licensing, untrained staff. Are these regulations going to hit them? And let's be a little bit specific about what are the new regulations?
So assisted living residents are required to be licensed if they're serving 3 or more residents in a residential setting.
All right.
I think that there is a preference or a trend towards setting some of these up in neighborhoods because it feels more like home and feels more like a residential setting.
Right.
There is some angst from neighbors occasionally to have that, the traffic, the people, the staff, all of that. I think the biggest obstacles for some of the providers currently with some of the new rules had to do with some of the protections that we felt were important for the residents.
Okay.
We implemented CPR training and first aid and response to falls.
Right.
And I think before, in the current rules, and which soon to be previous, facilities were able to develop their own policies and procedures on those things.
Okay.
And there were no requirements for assisted living facilities to respond to falls. So they could basically call emergency responders to come help somebody get up off the floor. So we did a lot of discussion about how can you do in a layman way an assessment to decide if you can help somebody get up from the floor or if you truly do need to call 911.
Okay.
We focused on some of the training and the staffing in the memory care units because we think that that's a unique setting with a unique type of care and services that are delivered, and it deserves better staffing and training in those settings. And then we focused on food and safe food handling. We have had some events in the past that have had foodborne outbreaks and illnesses. And so we created a subset of standards from the general food requirements for, what's the term we use?
The Food Safety Act?
Food safety, which is more of a commercial type setting. So facilities that are 20 beds or more would follow those rules. And for the smaller assisted living facilities, we put in a subset of what we believe are the safe food practices that could be handled very easily in a small assisted living setting, unique to the fact that it looks sort of like a home.
Okay.
And Jill, if I could, I would just add to that. There is no, and this is one of the big misconceptions, there is no requirement that all assisted livings have to have a commercial kitchen.
Okay.
For these smaller homes, we believe that this blend of requirements actually will create the environment so that residents can participate in preparing their own meals. That's part of their daily activities.
One of my favorite things.
But yet do that in a safe manner, since we're feeding vulnerable populations as well. So it's a blend of those two. And we're looking forward to getting some additional training out to facilities around these particular issues.
Right. And some of the worries were the parking spaces available, the number of bathrooms they might have to have, those types of things. Any thoughts on that?
So with the building, we have some building requirements now that do have very specific requirements for new assisted living facilities, actually. In the new rules, we've left the parking up to the local jurisdictions as to what's allowable and not allowable. What was the other piece that you were wondering about?
The restrooms.
The restrooms. So there are requirements for restrooms. They're not substantially different than what they were before. They will be under the Federal Guidelines Institute requirements for newer buildings, or if an assisted living facility undertakes a major construction or renovation, then they will be required to follow those FGI Institute requirements. But if they don't, the existing facilities would be grandfathered in as they are, and as they're built now.
Okay. So with that, this wasn't one of the questions I was really going to ask you, but are we looking at more training for the existing buildings, or is that just too big of a piece of pie to have to tackle at this time? So if the existing buildings that are being grandfathered in, the 600 and some communities throughout the Denver metropolitan area, they get a free pass?
Well, Jill, no, they don't. In terms of staff training, which is what we're talking about here, I think the department would be the first to say that we always wish there were more, because with education comes better care.
Right.
And we know that to be true. However, I believe that the Assisted Living Advisory Committee and the community that we worked with for over 2 years has reached an appropriate middle ground.
Good.
So all facilities, regardless of whether they are in existence today or going to exist in the future, those education requirements will become effective upon the publication of the new regulations.
That's
and
awesome.
we'll be working with the community to sort of roll this out over the next 2 years. In terms of providing opportunities for the operators to get appropriate resources. We have a newsletter, electronic newsletter, that the department put up right after the rule hearing in April, which will include not only frequently asked questions and answers to the new regulations, but more importantly, there'd be a training resource there for operators to be able to go look and say, hey, I want to do a 2-hour online training for my staff in memory care. So we're going to provide those resources in terms of connections and provide those connections with that. In addition, we're in the process actively this summer producing some of our own training materials that will be free of charge to all the operators and to the personal care workers that are out there to ensure that there are sufficient resources to support the new training requirements. So the grandfathering is really around buildings, not around staff. Staff training is required across the board as minimum requirement for all ALRs moving forward.
Excellent. This is an important conversation, and we're going to continue it in just a moment after another word from our sponsors.
Living and working with Alzheimer's and other dementias can often be challenging. Summit Resilience Training provides education utilizing non-medical approaches for those who work with our friends affected by dementia. Believing families still need one-on-one assistance, we provide classes which help them understand the diseases affecting their loved ones, offering strategies and techniques for success with activities of daily living and working with confusing behaviors. We offer in-home assessments to clarify symptoms of dementia diseases and help families work together to find moments of joy while living with memory loss and impairment. Education programs instilling person-centered care philosophies are offered for professional caregivers working in communities and homes, which can be customized for their staff. Training is also available for first responders, such as law enforcement, fire, and EMT personnel. We are passionate that people with dementias such as Alzheimer's, Parkinson's, and others are approached with compassion and understanding, and those who work with them have all the tools they need for success. Call us at Summit Resilience Training, 303-420-6988 to schedule a class or in-home assessment. Visit our website at summitresiliencetraining.com for more information.
It's time for Dementia Resilience with Jill Lorenz.
Okay, welcome back. I'm with Elaine McManis and Randy Kuykendall from the Colorado Department of Public Health and Environment, and we have been having a great conversation today. We have had some new regulations passed, which I feel are a win for my friends with diagnosis and their families, who I lovingly call my caregiver nation, because their big worry, and fair or unfair, over the years, the price of putting your loved one in a care community and assisted living has gone up exponentially. And I don't feel like, personally, the care has always met that increase.
Yeah.
And I felt like there needed to be some middle ground, and I really think you've hit on it. I think you found it, and I feel like it's a win for my folks. But how do you feel about that?
Well, Jill, we absolutely agree with you. We think this is a significant step forward in terms of, number one, as I mentioned earlier, the population being served in assisted livings today is significantly different than it was 15, 20 years ago. Our healthcare system is changing in ways, I'm so proud of the fact that in healthcare we're focusing on aging in place and giving people that opportunity to stay in their homes in a home-like environment as long as possible. But with that comes requirements to make sure we do that safely. Right. And I think that's what these regulations have hit, that middle ground. I think that's why it was so important, and I appreciate your good words about the department listening, because we have the opportunity to work in a community where we're all on the same side, regulators and caregivers, because we all want the best care for the people we're responsible for. So thank you. We count on you. I mean, it's important. I think people look to the Department of Health to really be that person that listens, that entity that listens and takes your worries and cares forward. And it's where they report any incidents they have. So at the end, I want you to think about giving some information out to my listeners about how they can get a hold of you if they have any questions about this. But Elaine, how are you going to roll these new regulations out? This seems like a monster.
Actually, this is where the good work begins.
Oh, yay.
So I'm kind of relieved that we're at this point. But
me too.
The rules become effective on June 14th.
Okay.
And then we're going to start the rollout in July. We're going to start with staff training and then take that training and post it for providers.
Okay.
As we conduct investigations and surveys of assisted living facilities, we're going to provide one-on-one information on how to comply with some of the new components of the rules.
Okay.
And we're going to issue an informational notice to the assisted living facilities as we do this. Mm-hmm. So it'll be an opportunity for one-on-one individual training from a state surveyor for that assisted living whenever they encounter the state. Mm-hmm. And we're going to roll this out through December 31st of 2020. That seems like a long time, but we have almost 700 assisted living facilities. The rules haven't been updated since 1986.
Right.
And so these folks need to have some time in order to move all of these new concepts in.
Right.
I think I'm very excited, and I anticipate that they will easily be done by the assisted living facilities because the layout of the rules and the organization of the rules is so much clearer now than the current rules that they have.
Right.
That I think it'll be easy for them to apply, but it will take some time for all the assisted livings that are out there to get up to speed with the new rules.
Well, my understanding after the meeting, directly after the meeting, was that a lot of support is going to be provided to these assisted living communities and the memory care units, and I appreciate that. I have at times been critical of some of the different places around town that are not keeping up with standards or training that I feel like they should have, but I've also been very appreciative of the ones who have. And I've talked about them on my show. And so I appreciate that we're seeing all sides here. It's important, just as I teach communication to families and to the workers in these communities, that everybody has to come to some common ground in the middle. And I think you've found that.
Well, we certainly hope so. Again, I think healthcare regulation is one of those opportunities we have to raise all boats. And I think it's really, really important for me to say on behalf of certainly the Department of Public Health and Environment, we know that the vast majority of facilities out there are doing a fantastic job, and we so much appreciate the services that are being provided to Coloradans across our entire state in assisted living environments. But by the same token, we want to make sure that every resident has that opportunity to receive the best care possible. And we believe that, by moving these regulations forward, addressing the changes in our healthcare system, and then supporting the providers to be successful is how we're going to continue to care for this population as it continues to grow.
I think what you have done with community leaders, with a lot of people participating and making it an open forum for people to come and have their input is amazing and greatly appreciated by me and the families I work with and even the businesses I work with. And I know it's important moving forward. If they have any questions, how would they get a hold of you? How do they get the answers to those?
So I give you the website. It's www.healthfacilitiesinfo.com.
Okay.
And that brings you to the main department webpage, and from there you can navigate to either provider resources, so you can actually go to provider resources for assisted living. Okay. If you follow those links, it'll take you to the newsletter. It'll also take you to an area where you can file complaints if you have concerns about care and services. It also lists our main number, so you can use that number to call and talk with somebody if you have some questions about this or any other provider type.
Okay, great. Is there a phone number or anything we can call?
We can absolutely feel free to call 303-692-2800.
Say that one more time.
303-692-2800.
Okay.
I misspoke on the website. It's www.healthfacilities.info.
Say that one more time.
www.healthfacilities.info.
Well, I really appreciate you taking time out of your busy work week to come and talk with me and clarify this for the communities out there and for the families who are saying, my community's been saying, we have to do all these different regulations. What does that mean? My line was flooded. So I, too, will try to put a link on my website for the Colorado Department of Public Health and Environment, and make sure that we have all the information for everybody out there in Caregiver Nation that you need. But I'm telling you, folks, I'm excited about this. This is a win for everybody. The communities will become much better at what they do. Families will have peace of mind when they come into these communities that they're getting the best care that they can get. And if you aren't, we always know that the Colorado Department of Public Health and Environment is there to help you if you need it. So thank you so much.
And thank you for the opportunity to help get the word out and to your Caregiver Nation for the good work that you're doing.
Thank you. I appreciate that. If you need anything, you can certainly reach me at 303-420-6988 or visit my website, www.summitresiliencetraining.com. I have a lot of free information, 26 bundles of every question you'd ever have and need to be answered. And you can listen to these podcasts on Cruisin' 1430 weekend programming. And I also list the podcasts on my website, and I tell you what they were about. So if you want to go on and look at those, you don't have to go through 500 different podcasts to figure out what you're listening to. I also load these on iTunes, Apple, Stitcher, Spotify, SoundCloud, and Google Play. We'll see you next week on Dementia Resilience with Jill Lorenz, and be well, everybody. Thanks for listening.
You've been listening to Dementia Resilience with Jill Lorenz. Visit her website at summitresiliencetraining.com to learn more, and join us next week as we learn more about dementia, Alzheimer's, and overcoming obstacles with a positive outcome. See you next time.